we are always developing strategies to educate our primary medical care providers as well as families on all the ways poor vision can affect managing diabetes. I mean, nobody really wants to talk too much about vision loss and poor vision, but we really have to, and we have to understand how vision loss affects people's quality of life, even in managing their diabetes, from something as simple as, the primary care provider telling them to go out and walk more or exercise more. But if you have vision loss, you may not be comfortable, you may not feel safe, you may be afraid that you're going to fall and things like that. So we have to make sure that providers and others understand that. Even something like reading the medication bottles or drawing up the insulin syringe. I mean, these are all things that unfortunately can become difficult when you have vision loss. And so communicating to all providers, I think, is important. We also want to encourage all providers to have a list of resources available, and their materials in their office should think about people who might have vision loss. So it could be in large print, and it should be accessible to people who are visually impaired. I think as other, eye specialists sort of examine and treat people with permanent vision loss, from diabetes-related eye disease, asking a couple questions, are you having difficulty? I always have a lot of retina colleagues myself, and so the exam is, they see lots of patients, there's little time, but just asking just a couple of questions like, are you having, problems performing everyday tasks, because of your vision, or how is vision affecting your quality of life? That will start the conversation going, and then prepare patients for the next step. So whether it's referrals and resources, for vision rehab for something like myself. And then, if the doctor's team kind of ahead of time could have already prepared a list of local resources, even if it's like a local agency like the Lighthouse or another agency, or be able to refer them to places like the National Eye Institute or Prevent Blindness, that would help people, I think, would go a long way. The idea, though, is, to impress upon our patients and their families not to give up hope. I mean, vision loss and eyesight is a very important part of functioning, and we want people to know that, we're here for them.
Make a commitment to yourself that you're going to start the healthiest lifestyle possible, and that will mean, everything that you're eating and all of the other actions too, but also to take care of your eyes. And then make a plan and a list of all the actions that you need to do